Hello, this is Dr. Do again. This video is still on the systemic approach for medicine. I have talked from the invisible major four organic compounds to the cell structures, and then talk about the tissue, which are the group of the cells have the same morphology, same function to carry on certain functions. So I talk about tissues, talk about epithelial tissue is the one of the major one, and also talk about some typical diseases associated with each tissues, like the epithelial tissue, nerve tissue, or connective tissue, or the other tissue of the muscular tissue. So these are the four major tissues formed, organs, and then systems. So this is a kind of review, and today I'm going to move on to talk about the diseases of individual tissue and integrate into organs, because when we talk about the diseases, they're in the tissue, but the tissue really hosted by the organs. Actually, the organs are the hosting of the tissues, and they hosting each other. But it's just probably not terminology to use it here, but just means when I talk about tissue disease, it has to talk about in the organs. So let me just start from epithelial diseases. First of all, it could be very minor, like the abrasion on the skin, or could be very serious, the ulcer, or even the tumor, neoplasma, occurring in the epithelial tissue. So let me just list the where you find this epithelial tissue again. From the eye, from head to toe, everywhere. From the eyes, on top of the conjunctiva, on top of the cornea, and also from the internal, from the cavities, the nose, nasal cavity, oval cavity, or oral cavity, which is and also the trachea down to the lung. In the lung, there's the parenchymal tissues, which are the lung cell tissues involved in the functions of the lung, and also lying on the vascular surface. So if I talk about this, the epithelial tissue lying on the vascular surface, so you probably know it's everywhere, right? Ubiquitous in the body, anywhere you find it. So that's just to wrap it up, where it's located. And typically, in addition to that, the lining up of the trachea, lining up of the digestive system from the stomach, esophageal stomach, and intestine, a large intestine, and also, so this is the other part of the serious epithelial disease that could occur. So let me just bring up the very straightforward the abrasion, where the abrasion and ulcer, where they can occur, where if it occurred, what kind of abrasion or ulcer you can just ignore it, manage at home. What kind of abrasion or the ulcer you have to seek medical attention. So let's talk about the skin as a superficial abrasion. So usually we do it all the time. You scratch somewhere, you file or not file, whatever happened. If it is only scratch on the superficial, so that's called abrasion. But it's deeper, that's called ulcer. So this is a very minor, you can manage at home. And the abrasion but if it is in the cornea, you cannot manage at home, even though probably the management is just the simply eye job, but still you need to see the doctors. The purpose for seeing doctor for the cornea abrasion is to identify, to diagnose whether it is abrasion or it is deeper ulceration, or whether it is just simply scratch mechanically, or there's some viral or bacterial infection on top of it. So you have to, if it occurred in the eye, either from the injury or you scratch by your fingernail or the branches, or anything. If that's the case, this abrasion, you need to see the physician. And in terms of the ulcer, internal, and the ulcer can occur in the external of the body, like the skin, the ulcer which is deeper to the epidermis, going down to the deep layer. So if that's the case, I think if you're healthy, young, without any comorbidities, you probably usually just injury and it's going to recover soon, unless on top of this there's infections. So if that's the case, you need to see a physician. However, if you have comorbidity, systemic diseases, if you have even the skin abrasion, for example, diabetes, if your skin just abrasion, or the obesity, because so many adipose tissue impaired blood supply for the skin. So if that's the case, even though it's an abrasion or ulcer or an ulcer, you need to see a physician, just in case, to check it, make sure there's no deeper communicating injury into the deeper tissue. So this is about the external ulcer. In terms of the ulcer inside of the body, from the most notorious or famous or well known is the gastric peptic ulcer, either from the stomach or from the duodenum. I think I have mentioned in previous video. I'm just going to remind you again. You do not know probably, but just the symptoms and the risk factors. Risk factors including reflux, chronic gastritis, or the or some chemicals or medications cause this erosion of the epithelial tissue on the stomach or duodenum. So if that's the case, the symptoms like the pain, abdominal pain, not just the discomfort, it's truly aching pain, and also it's not just one time it's gone. If it is ulcer, it's not like that, it's persistent. The pain either associated with the food intake, like a gastric ulcer, or at the stomach empty, where it's about 2 or 3 hours after meal. So if that's the case with reflux and gagging, and sometimes really in this the seasonal pattern in the late fall, early spring, or during the winter. So if that's the case, you need to get it checked. Probably it's not ulcer, but just make sure a simple barium swallow X-ray will tell whether you have ulcer or not. So this is about the typical epithelial diseases like the abrasion, the ulcer, either the eye or the skin or the internal digestive system. And in terms of the epithelial tissue, there's another variety of diseases associated with the blood vessel. However, the terminology of the lining tissue, it belongs to epithelial, but it's called endothelial tissue. So this is endothelial, is the lining structure on the blood vessels, and associated with inflammation and also sclerosis. So this is the and also another typical diseases associated with this epithelial tissue are the neoplasma, which are the growth, either benign or malignant. So so this video just stop here, talk about the abrasion and the ulcer, and just for those people who had risk factors or who is in doubt whether you have or have not, just get it to talk to your physician to get it checked and to make sure not to miss the serious problems like the eyes or the corneal abrasion or the internal gastric or duodenum ulcer or the diabetic skin problems. So I'm going to stop here today and continue next video, move on to the endothelial problems, which lining on the blood vessel, and also probably, if possible, talk about the adenoma or the malignant cancer start from epithelial tissue. I'm going to stop here today and continue next time. Thank you for watching.